Retiring is a hard decision to make. But once you factor in the healthcare costs, necessities, and concerns, it only makes the decision tougher. Find out how to navigate this conversation and thoughts of the mother of all concerns, healthcare, and what you can do about it on Consider This Program. Welcome back to Consider This Program. My name is Grant Soliven, and I'm your host.
And I'm Jamie Burton.
Oh, Jamie, back together. Theme of the conversations, the mother of all things, and today we're specifically going to focus on the segment, the mother of all concerns, healthcare. Now,
Yes.
So glad to have you on the show, not only because you're an amazing mother, and Mother's Day is right around the corner at the time of this recording, but also you had your mother go through a situation that actually is a perfect case study and story to talk about the concerns of healthcare. So I'm just going to tee it up, hit it off, and you're good to go.
Absolutely. So my mom, she was a pharmacist before she retired, and she had been with the same company for 25 years. And she was getting to the age where she was seriously considering retirement, and she had a plan in place. She knew that if she retired, that this company was going to allow her to stay on their health plan until she hit Medicare age, and then she could switch off to Medicare and be able to live through retirement that way. They were also going to allow my father to stay on that health plan until Medicare age because he was self-employed. So they had this whole plan in place of how they were going to have health insurance through their retirement years until they qualified for Medicare. And then she got a letter in the mail that totally derailed all of that. She got a letter in the mail that said that this company was no longer going to allow retired employees to stay on the healthcare plan. So this whole plan that she had in place for her and for my dad to be able to retire when they wanted to was totally derailed, thrown off track, because they hadn't planned to be taking out all of this extra income from the assets that they had saved to be able to afford another kind of health insurance outside of the plan through her employer. So that really pushed her back. And she was thinking, I'm not gonna be able to retire now. I don't have a plan in place to take out the assets that I would need to pay for some other kind of health care that's going to be outrageously expensive. So I'm just going to have to keep working. It turned out that she ended up getting another letter in the mail that said, hey, if you retire by November 30th, which would have been like the next 2 months, then we will allow you to stay on the health insurance plan, give you a stipend to help pay for that. It's still going to cost you some money, but it's better than having no option at all. But if you retire by then, we'll allow you to stay on it. Mm-hmm. So she was afforded this small blessing to be able to stay on the health insurance plan so she could go through with her retirement plan. But that is definitely not the case for a lot of the people that we take care of that are getting towards retirement that don't necessarily have a plan of how the heck they're going to get to Medicare age.
100%. And so, Jamie, thank you for sharing that very personal story about you and your family, because it's the elements of that conversation and the story we want you to really focus on is that this environment is constantly changing and evolving. I mean, just like taxes, just like the investment world, healthcare is constantly changing. And so it's a continued expense. 18% of our population was born in a certain age range, and that makes up the largest part of the baby boomer group. And they're getting ready to enter the highest medical, you could say potentially based on statistics, the highest medical output for their golden years. And so this is a really big concern. So, Jamie, that was a period of time some years ago. And some things have changed since then, right? Some things have adapted. So not only are we seeing companies start to change and modify their long-term healthcare plans for the employees, just like they changed defined benefit plans that pensions came out of, right? But we've also had elements come into play that maybe weren't necessarily as well known as they are today. And so for families that are looking to engage and protect themselves using gap coverage, so the gap between when you retire and Medicare hits, there's a lot of options. So, Jamie, let's talk through a little bit together the exchange, state and federal. Let's talk through private, and let's talk through other elements and things that that are accessible to families. And then, actually, you know what? Let's flip that for a second, actually, in our conversation. Let's start with COBRA, because COBRA is the big one and the most expensive, unfortunately. And so we'll start with COBRA, and then we'll go through those elements. So, Jamie, talk about COBRA, what it is, besides a very venomous snake. Talk about what it is, how it applies, and what are some of the mechanics that need to be considered.
Sure. So with COBRA, it's legislation that was passed that it allows for if somebody were to retire or leave a job, or if they were fired from a job, or if they had a divorce or the loss of a spouse. There's a lot of different qualifications for when COBRA could come into play. But what it says in COBRA is that somebody is able to stay on a health insurance plan through an employer. But it's like Grant said, it's very expensive. A lot of times when you're on a health insurance plan, the employer will pay for a portion of that health insurance, and then you would pay for the difference. With COBRA, you could pay up to even over 100% of what that premium could be. It could be up to 102% that you're having to pay towards that that health insurance plan. So it can be very, very costly, but it is an option.
It is. And so, Jamie, some people are going to be listening to this and watching this and going, wait, did you just say 102%?
102%.
Folks, she's not kidding. It is 100+%. So, you know, my wife, my beautiful bride, she transitioned companies recently. It's interesting, you know, with this labor shortage that we're going through at the time of this recording, you know, people are fighting for employees, right? And if you're looking to transition a job, now's the time to do it. But, you know, she got brought into another company, and then she got, you know, scalped out again. And she got that letter for her COBRA, because obviously when you leave employment, you get the letter no matter what. And when I saw the 100+% they're asking for premium for her COBRA, I thought, no, this is ridiculous. It has to be a lie. No, it is not, folks. It can be 100+%. But when you have medical needs and expenses, sometimes it's the price you pay. Now, COBRA is designed to keep you covered for typically 18 months. You can go 36 under certain special circumstances. But again, now that there's other alternatives out there for us to use, COBRA may not always be just the best option. It's the quickest and easiest in a circumstance, especially if you were let go from your career, not by your means or your timeline. And so we'll talk next about kind of the federal exchange. We won't go into how the Affordable Care Act came into being. I don't want to spark any political conversations. But we'll talk about what it is today and what's changed. And so, Jamie, federal and state exchange, in the past, in order to get credits, meaning you can only make so much income in order to get fully subsidized for the health care. It was a one-size-fits-all. If you made this much money, you're shoved out of the subsidies. But that's changed. And so let's talk about how some of that's changed.
Yeah, so if you go on the federal or the state exchange, there's a lot of different options available. You just have to kind of go on there, find what options are available to you. You have to input your information. So they're going to be asking you what your income is and what, you know, a lot of personal information about you. But then it's going to spit out, here are the different options you have. Here are the different costs that it has for you. So you could have a higher income. You're probably going to pay a higher amount in premium for the healthcare that you are going to get. But at least you have an option available to you, where previously you had to be a low income earner or have relatively no income at all to even qualify.
Yeah, and especially to get a lot of those subsidies. So what Jamie's saying, folks, is, you know, they started creating bands for those subsidies. So it wasn't just you've got to be below 4 times the poverty line or whatever that metric they were using was. I say that facetiously. But, you know, now, depending on your income bracket and your tax filing status, you can still receive a portion of subsidies up to a certain income limit. And so I think it's 115 plus thousand. Don't quote me on that. It's definitely right there now. So where before, if you made more than 38,000, right, and you had a car with 3 wheels, right, you couldn't get any subsidies. So it's just, though they've really adapted and evolved the system to really compensate for the growing population that's going to need gap coverage or just insurance in general. And here's the other element. Right, everyone's so afraid of the private insurance companies, but realistically, if you know how to look and where to look, you might get a good deal. We have families who have gone to the private exchange because the Affordable Care Act and their income didn't allow them to get good insurance at a reasonable price. Went to the private exchange and found actually quality insurance that was reasonably affordable for what they were looking for to bridge that gap. And finally, we've had some team members and families even use religious-based insurance programs. Now, they don't operate exactly like traditional health insurance does, but if you're a relatively healthy individual, you have the appropriate resources, you've done the appropriate planning, sometimes it can make sense. And those are very relatively inexpensive programs, and under the right circumstances are very powerful for families. And so there's options available to you. It's not like Jamie said, it's not a one size fits all, and it's constantly evolving. But we also wrap this conversation into the healthcare conversation. That is long-term care. Now, it is a very, what's the word I want to say? Dark looming topic that kind of hangs itself over families because of the cost that there is inside the long-term care environment. Also, the long-term care environment has changed drastically. Where when you and I started the industry, Jamie, you could buy a tool, a vehicle from an insurance company, and you would pay premium, and they would spit out a monthly benefit, etc. And they were called just kind of the single standalone products. Well, because of the actuarial science and the changing environment, those are now mostly gone. And so there are still options available. Long-term care is a scary topic, but it's easily discussed. And with good planning software and good planning tactics that teams like ours employ, we can walk you through what those situations look like. How would a long-term care event strategically affect your family? Can you afford to do so? What does that look like? What are we actually going to plan for? Right? Because, most of us fade away. Not all of us drop dead. And so that's a potential reality, but there's also elements that you can choose, right? So, Jamie, you can have in-home care. You can have other care. They're starting to build a lot more mental care facilities, which are helpful. And so there's a lot in that discussion. So, Jamie, again, appreciate you talking what you went through. A lot of good digestible information there. If you're looking to engage deeper with Jamie or one of our other team members, please reach out to us, 800-928-4001. Schedule a meeting to talk about your overall plan and how this mother of all concerns fits in that and what you're doing about it, what we can do about it from a planning perspective. Also, if you're looking for checklists, other things, other elements to conversations that you just need some resources to start conversations with, please, our website, www.yourlifeafterwork.com, is all of our information's there. Brittany is on the other line of that phone and usually on the other line of that email answering questions. So she'd be more than happy to get you set up with a team member. So appreciate you being with us. Hope you got some good information. Look forward to seeing you again soon.